All right, welcome back to another episode of Discussions with Dr. G. I'm Dr. G, your sarcastic nursing professor, and today we are going to discuss chemotherapy medications, where we try to make sense of the chaos that is chemo and maybe laugh a little so we don't cry. So let's start with the basics. What the heck is chemotherapy? I mean, really? At its core, chemo is basically the art of poisoning rapidly dividing cells. Sounds dramatic, but that's literally what we're doing. The goal is to target those cancer cells that are multiplying like rabbits. But, and here's the kicker, your body has other cells that also divide very quickly. Hair follicles, the lining of your gut, bone marrow, yep, they're all fair game. That's why when you think of chemo, you think of hair loss, diarrhea, pancytopenia. It's not just the cancer cells that are getting hit. It's all the innocent bystanders too. So let's break down those side effects for just a second. Hair loss. Yeah, it's not just the hair on your head. Eyelashes, eyebrows, arm hair, the whole shebang. Then there's diarrhea, because your GI tract is lined with cells that turn over super fast. And then pancytopenia. Big fancy word for low blood cell counts across the board. Why? Because your bone marrow is collateral damage in this war. So, if you're wondering why chemo patients look and feel the way they do, it's not just the cancer, it's all the friendly fire from the treatment itself. And sometimes patients are surprised by just how all-encompassing these side effects are. A good way to remember what chemo targets is, if it grows fast, it's probably going to get hit. That's why you'll also see mouth sores. Chemo treatment is not just about killing cancer, it's about managing the fallout. All right, so now that we've set the stage for why chemo is both a blessing and a curse, let's talk about the different classes of these drugs and how they each bring their own special brand of chaos. So chemo isn't just one drug. It's a whole dysfunctional family. Let's start with antimetabolites. These are the fake it till you make it, or kill it, drugs. They basically pretend to be normal cell building blocks, sneaking into the cell and then messing up DNA or RNA synthesis. Methotrexate is a classic example. It's a folic acid analog, so it tricks the cell, but then halts its ability to make DNA. You'll also see cytarabine, 5-FU, and mercaptopurine in this group. They're used for leukemias, lymphomas, and even some solid tumors. The toxicities, guys: bone marrow suppression, mouth ulcers, liver toxicity, and even some weird stuff like hand-foot syndrome with F5U. This is a skin reaction that causes redness, swelling, pain, and sometimes blistering on the palms of the hands and the soles of the feet. And don't even think about giving these to pregnant patients. They all pose a major teratogenic risk. Next up, anti-tumor antibiotics. These are antibiotics that don't actually kill bacteria. They just go after cancer cells. Doxorubicin, also known as the Red Devil, is infamous for turning your urine red. So no, it's not blood, it's just the drug. But the real kicker with doxorubicin is cardiotoxicity, which ranges from shortness of breath and chest pain to heart palpitations, swelling in the legs and feet, and dizziness. You gotta watch the heart with this one. Bleomycin, on the other hand, is all about the lungs. Pulmonary fibrosis, where lung tissue becomes scarred and thickened, making it difficult to breathe, that's the big risk. So, baseline and periodic echoes for doxorubicin, and pulmonary function tests for bleomycin. And of course, myelosuppression and hair loss, still on the table. Then we have antimitotic agents. These are the ones that trip up the cell's ability to divide. Vincristine is a big one here, and it's notorious for causing peripheral neuropathy. Think foot drop, tingling, all that fun stuff. Paxloxil is another, but it can cause severe allergic reactions. So you got to premedicate with steroids and antihistamines. And as always, keep an eye on those blood counts. Now, alkylating agents. These are DNA's worst nightmare. Cyclophosphamide can cause hemorrhagic cystitis. So if you see blood in the urine, that's not normal. Cisplatin is the one that loves to wreck the kidneys and the ears. Wonderful nephro and ototoxicity. If you're treating a patient with cisplatin and their creatinine starts to creep up, you're going to want to pause treatment and flood them with fluids. Hydration is the key with these drugs, and you have to monitor renal labs and hearing. And let's not forget topoisomerase inhibitors. These guys tangle up DNA so it can't unwind properly. Topotecan and etaposide are the main ones. They're used for ovarian, cervical, and lung cancers. But again, bone marrow suppression and nausea are big issues. So you're always checking CBCs and making sure patients are hydrated and pre-medicated for nausea. It's a lot to keep track of, but once you know the patterns, it starts to make sense. Sort of. Maybe. Anyway, let's talk about how we actually keep patients safe when we're giving these drugs. So, how do we keep patients from falling apart while we're nuking their cancer? Nursing interventions are everything. First, you're always checking blood counts, WBCs, platelets, RBCs, CBCs, because chemo loves to tank everything. Organ monitoring is huge too. Heart for anthracyclines, lungs for bleomycin, kidneys for cisplatin, nerves for vincristine, and hydrate. Seriously, hydrate or dihydrate very, very much fits this situation, especially with drugs like cisplatin and methotrexate. Safe handling is another big one. Some of these drugs are vesicants, which means if they leak out of the vein, they can destroy tissue. Doxorubicin and the vinca alkaloids are notorious for this. So double check those IVs and don't be afraid to ask for help if something looks off. And of course, double check your drug calculations. These meds have a very narrow therapeutic index, and there's not a lot of room for error. Patient education is a whole nother beast. You have to talk about teratogenic risks. Chemo and pregnancy do not mix. You have to explain side effects and why hydration is so important. All right, that's the whirlwind tour of chemo drugs, how they work, what they do to the body, and how we try to keep patients safe. I know it's a lot, but if you remember the patterns and keep an eye on the big risks, you'll be ahead of the game. Thanks for hanging out with me today, and don't worry, we'll keep breaking down meds in future episodes. Until next time, keep your humor handy and your IVs secure.